Welcome everybody to Pre-Health Shadowing for another virtual shadowing session. My name is Nina and I'm really excited to host you guys today. We're going to go ahead and get started with a couple housekeeping before we begin our virtual shadowing session. So I invite you guys all to drop in the chat where you're Zooming from. Pre-Health Shadowing is a virtual platform, so it allows students from all over, not only the US, but the world, to come together and kind of gain some insight into potential health fields. Another quick update for you guys is if you guys are not receiving emails, there's a couple things you can do. The first thing is to be sure that you are signed up for our email list. You can do this by going to the link down here at the bottom left, www.prehealthshadowing.com/join-us. When you do that, you will be receiving a weekly email with all of the speakers that are scheduled for that week, with the times and the registration information, as well as the Zoom meeting. Another thing that you guys can do is go to your email and mark all of the pre-health shadowing emails as important. By doing so, you're telling the email that you want it to go straight to your inbox rather than your spam, your junk, or your promotions. Another thing you could do is save pre-health shadowing as a contact, and that will also send it to your inbox. If you guys are experiencing any difficulties with this, feel free to email us at info@prehealthshadowing.com. Another quick update for you guys is we now have closed captioning for all of our live sessions to accommodate students with hearing disabilities. One more notification is our website has been going in and out of failures. It did crash after one of our virtual shadowing sessions 2 weeks ago. And so we have been working to raise money to keep our nonprofit program afloat. Pre-health shadowing does run solely off of donations. And so I am asking you guys to please help out. We appreciate anything you guys are able to donate. We have been working really hard to keep this up. And so please share this link. Please post on your social media and tag Pre-Health Shadowing. You guys can also find this on our website under the Donate tab. Don't forget to tag us on Instagram, Twitter, Facebook, and TikTok for an opportunity to get reposted on the official page. Pre-health shadowing is not a secret, and so we encourage you guys all to share this opportunity with everybody you can think of, so that ultimately everybody who's interested in going into the health field has that opportunity, no matter where they are, what level of education they have, just that they can reach their goals. Students are eligible to take a post-shadowing assessment to receive a certificate that verifies their virtual shadowing hours. So I encourage you guys to take good notes and ask our speaker good questions. This is an amazing opportunity that we have, and so please use it to the fullest. During the duration of this presentation, I welcome you guys to drop any comments or questions that you have in the chat, and we will ask them during the Q&A portion of today's session. So without further ado, I would like to welcome to you our speaker for today, Dr. Daihnia Dunkley. Welcome.
Thank you so much. I had myself on mute for a second there. Thank you so much for having me. I'm really grateful to Pre-Health Shadowing and to Nina for this opportunity to speak to you guys today. So I am a registered nurse, so that is what we're going to talk a little bit about today, my journey and experience as a registered nurse, and different careers and pathways that you can take in nursing. So do I just jump right in and get started, or did?
Yes, please do. Thank you.
All right. So I prepared a little presentation, and I'm going to go ahead and share my screen so we can go ahead and get started. Okay. Everything good? Looking good? Okay, perfect. Okay, so we're talking about nursing today, right? A career in nursing. And so she introduced me as Dr. Daihnia Dunkley, which I do have a PhD in nursing. So it gets a little confusing when I explain to people that, well, you're a doctor or a nurse? It's both. My doctorate is a PhD, which is the doctorate of philosophy. So gets a little tricky there, but just want to tell you a little bit about me. But we'll start with the objectives first, right? Let me not get ahead of myself. So I'll tell you a little bit about me, my own journey and pathway, and then we'll talk about some educational pathways and career pathways for nursing, which there are many. And I'll tell you a little bit of what it's like on the job, and then we'll do a little question and answer session. So just a quick poll. I don't know if we can, to see how many folks are interested in a career in nursing. If maybe you put in the chat, a thumbs up or something.
Yeah, so I just released the poll, and this will ask you which best describes you, where you are in your journey, what career path that you're currently interested in, and how many pre-health shadowing sessions that you've been to.
Awesome.
So we'll go ahead and leave this up for 5 more seconds, maybe. Go ahead and answer that if you haven't yet. And then I will go ahead and release the results.
Okay.
Alrighty, so guys, take a look at that.
Okay, so I do see we have some nursing interest here. Great stuff. Awesome. So I know you guys have been exposed to a few different healthcare pathways from all these awesome sessions. So I'm excited to tell you all about nursing. So again, I am a registered nurse by training. I got my Bachelor's of Science in Nursing from Hampton University, and then I went on and got a master's, and then subsequently PhD from University of Phoenix. Right now, I function primarily as an assistant professor of nursing for Farmingdale State College. And I also am an entrepreneur. I have 2 organizations. One is a nonprofit, the League of Extraordinary Black Nurses, and the other is called Danish Joy. It's a consulting firm. And I, in my spare time, what little I do have, some of the things I like to do, just to read, shop, trying new foods. And I am a huge fan of soca music. I have a West Indian background, so that is my favorite music to listen to. But to kind of get back into career pathway, right? So I started out as an LPN. So in high school, I had the opportunity to apply to a vocational school, which many of you might know is like a trade school. So you go in and you get a certificate based on whatever that you're studying, carpentry, or, I think cosmetology was available, things like that. And they also had LPN program available. So half of my high school day was spent doing my LPN curriculum, and the other where we would go to this other location to do that. And then the other half was spent doing my regular high school stuff. So that started around my junior year in high school, and I finished up high school with an LPN certificate. And then I took my boards while I was in college. So I went straight to college after high school. I initially didn't want to be a nurse. I actually ended up falling in love with nursing. I initially wanted to be a physician, an OBGYN. And my mom, who was a nurse, decided to encourage me to take this opportunity to go into this LPN program to see, well, do you even like medicine? Are you going to like healthcare? Because up until that point, I had no hands-on experience. And so I was just going off of what my childhood fantasy was, So she's like, to get into the real world, why don't you try it and see if you even like being in healthcare? And I ended up falling for nursing. So here I am 20 years later, an RN. So I did my bachelor's right away. While I was in college, I took my LPN boards and was able to actually work in the field. just doing some per diem and part-time stuff in home care and things like that, things that I could handle while I was going to school full time. And graduated with my bachelor's. I worked for about 5 years until I decided I wanted to go and do my MSN, my master's. So prior to that, I worked in labor and delivery as a staff nurse, a mother baby nurse, I did home health care for a while. I did some community health care, all pretty much centered around maternal child health, which was what I really wanted to do. And so instead of being an OBGYN, then I became a maternal child health nurse. So I still had that passion at least. And so it took me about 5 years doing all these roles to go back and get my master's. And once I got my master's, I started to kind of pursue more leadership roles. So I came, title was a clinical nurse leader, which was similar to like an assistant nurse manager. But then I became a manager and eventually an assistant director and then director. So those were more administrative roles, even though I still had oversight of staff at the bedside anymore. But still was able to participate in all the other clinical functions in terms of overseeing them. While I was sometimes I would teach as an adjunct clinical instructor, and I did kind of dabble between being an agent nurse leader. So sorry, the internet connection has been kind of weird all day because of the storm.
No worries.
Can you hear me?
Yes, we can hear you. But we can no longer have the share screen.
Yes. Okay. I'll go back and share again.
Thank you. No worries. Students, just another reminder. You guys
hopefully it doesn't do that again.
Feel free to drop questions into the chat, and we will answer them during the Q&A portion. If you guys are also interested in having potentially more nurses in pre-health shadowing, I encourage you guys to head over to the website. We do have a speaker nomination page, and this can be found under the contact tab. And so if you guys see that, you guys can submit nominations for professionals that you'd love to have us host on pre-health shadowing, and our student team will reach out to them. Also, you guys can get volunteering hours for sending in nominations. So if you're interested, if you send in 15 nominations, you can get about an hour of verified volunteering. That looks great for applications, and it's 100% remote. You get to do it on your own time, on your own schedule. So definitely check that out on our website, www.prehealthshadowing.com. Yeah, and then we can continue. Thank you so much.
Okay. All right. I'm just praying for no more connectivity issues. So I was saying that between working as a nurse leader, I would sometimes teach as a clinical instructor. And what that was is that I would take the students in nursing programs to do their on-site clinical rotations and get their hands-on experience. So I did that for some time while I was working on my PhD. And then when I finished the PhD, it took me about 6 years to do that. Then I decided I wanted to, maybe about a year later, I decided to go into full-time teaching. And so now, as I said before, I work as an assistant professor teaching full-time, and I'm teaching what I love, OB and obstetrics and pediatrics. So that's kind of my pathway in a very shortened nutshell. But I wanted to go into just a little bit about the different pathways that you can take in nursing, because I think there might be some misconceptions about what nurses do, or what their education is like and what their training is like, and what else is there to do in nursing besides being at the bedside, which there is so much. And so many people take many different pathways, right? So sometimes people will decide to kind of get in the door by doing a role like a certified nursing assistant or a CNA, or get in through becoming an LPN. Um, or some people just decide go straight to the RN role. Whichever pathway you choose, can be quite fulfilling. We'll go through some of those today. So a certified nursing assistant is one who kind of assists the nursing process by, doing more so the activities of daily living for patients, feeding, bathing. They also are trained how to do vital signs, so temperature, blood pressure, and things like that. Um, Everything that they collect in terms of vital signs or whatever they do with the patient, they then report their findings to the nurse, who will make an assessment, if they're going on that's wrong, or whether it's wrong. They do have to report their findings to the nurse. So an LPN, which is a licensed practical nurse, is just the scope is a little wider than that of a CNA. They still do the activities of daily living and things like that, vitals and that stuff. But they also have a component of gathering more in-depth data, and they can also administer medications. They can do certain procedures. They can draw blood. They can in some states they're allowed to put in IV, things that are a little bit more expanded in terms of their role. An RN, the difference between the LPN and RN role is that a registered nurse is trained a little bit further in terms of how to look at and assess the whole patient, right? So we're talking about not just the clinical picture, but in a more holistic view. So we take additional courses outside of the anatomy.
Okay, I apologize for the technical issues. Our professional is currently experiencing weather in a storm, and so that is a little bit why the connection is really poor, but I anticipate she will be coming back shortly. I apologize for the inconvenience. There have been a lot of things outside of our control happening today with our speakers, so I appreciate all of your flexibility, and thanks for sticking around. You guys can go ahead and start stuff in the chat. Thanks, guys. I appreciate. I'm going to pause this recording.
Nurses take additional courses so that we're able to view the patient a little bit more holistically. We take sociology courses, humanities, in addition to our science classes, to kind of give us a broader scope in terms of how to deal with complex situations. So we take communication courses, so it's a little less task driven, and our connection with our patients, it shows through our connection with our patients, because we're basically there 24/7 with the patient. And so outside of just handing out medications and doing procedures, these are things that we're also trained in, how to communicate with families and how to deal with complex socioeconomic issues. So that's infused into our 4 years, or even 2 years if you do an associate's program. We'll talk a little bit next. That's the difference between the licensed practical nurse and the registered nurse. It's just a more expanded role. So we'll talk a little bit about the different pathways in terms of how to become an LPN or an RN in these next slides. So an LPN basically has a certificate program that they go through. So like I explained, my program took about two years in terms of the school years, but if I was just going full-time straight through, it would take about a year, maybe a year and a half to complete full-time. And I can take a course at a community college, or like I did at a vocational school. There are some private institutions that offer LPN programs, or some of the colleges that offer an RN option sometimes will offer an LPN option. The other thing is that if you're going to school for a bachelor's degree in nursing, that some states will allow at a point in time, once you've completed certain requirements, to sit for your LPN board. So they'll say that you qualify now because you've taken X amount of courses, that you can also take PN boards. And a lot of people will do that and start practicing as a nurse, a licensed practical nurse, before they complete their RN program. So that's also an option to do that. So an LPN program is a certificate program. It is not a degree-based program. The RN pathways are a little bit different. As you can see here, there's so many different ways to become an RN. So a lot of places have now gone away from the diploma RN programs. Most of the diploma programs that still exist in the United States are hospital based. So you'll see like a hospital that has its own RN program. Those are mostly the places that still offer a diploma. Options in terms of being able to market myself and getting hired, because a lot of places now are starting, like I said, with the entry level of a bachelor's. So it's really competitive if you only have an associate's and everybody else is applying with a bachelor's. So it just gives you a little bit more leverage. So they have an RN to BSN option. So what they'll do is apply your credits from your associate or diploma program and infuse them into the bachelor's degree program, and then you just take missing, and that way you'll then finish up with your bachelor's degree. There's also for folks who decide I don't want to do whatever I got my other bachelor's in anymore. So I have a bachelor's in, I don't know, English, or I come from a marketing background and really want to do healthcare. I really want to go into nursing, but I already have a bachelor's degree in something. Then you can apply whatever coursework you had that applies to nursing, and then you would again just take the remaining requirements. They call it accelerated because you already have a degree. So it's not necessarily that you need the degree, you just need the nursing requirement part. So those are basically the options that you have, from a diploma all the way to a bachelor's degree. And then there are several pathways if you start off with a diploma or associates to get the bachelor's degree. So lots of flexibility there. The point I want to make about deciding whether or not you want to be an LPN or an RN, they are both licensed nurses, right? Just a different scope. And so they're both, you require you to take a licensing exam with the state that you live in, or the state board of nursing in your particular area. So one is just tailored for an LPN curriculum and knowledge, and the other one is tailored for the RN, right? So remember when I think I mentioned that if you are in a bachelor's program, you can at some point sit for your LPN boards once you've completed a certain of the curriculum requirements. Once you finish, you have to take the NCLEX RN. Okay, so one doesn't substitute the other. Okay, so then we get into our advanced degree options. So to become a nurse, like I mentioned, those different pathways are and requirements. So typically at the, what we would nurse associates, bachelor's degree, who's working this specific clinical areas, whether it's a medical surgical unit, and it was mother baby, labor and delivery. Those are all different specialties that you can go in once you are a registered nurse. It's not here on the slides, but I will say that certain areas
All right, me
I'm
again.
back.
Oh, perfect.
Let me try something else. Let me move a little bit further. And sometimes, depending on where I am in the house, the connection gets stronger. 1 second. Okay, so let me turn the chair. All right, so let me. I promise we're gonna get through this, guys. Okay, so right. So I was saying the different specialties. So with a new graduate, or yeah, with new graduates, there's sometimes a reluctance to hire a new grad to certain specialties because sometimes it can be a little overwhelming to just come from your nursing program and straight into a very um, complex patient care area. So areas like the emergency room, sometimes labor and delivery, and sometimes the ICUs. It's not an all or nothing because there's exceptions everywhere. Um, will shy away from hiring grads until they've gone through some kind of orientation or residency program or training program to kind of acclimate them into that environment. So it's not impossible if these are the areas that I mentioned, if these are some of the areas that you want to go into, it's not impossible to get a job as a new grad in those areas, but it might be a little bit more difficult or a little bit more competitive. Um, so just wanted to clarify that. But then, so at the bedside, you'll find sometimes nurses that do go on to get advanced degrees and just prefer to still be at the rank of staff nurse, and that's perfectly fine. Nursing is a complex job. Some people prefer the hands-on interaction day to day with their patients and never decide to leave the bedside, even though they get these advanced degrees. The other thing that's not here on my slides before I go into the pathways for advanced degrees is certifications, right? So once you've gotten a certain amount of experience in your specialty, so for me, since I'm an OB nurse, what you can do is there's a requirement to when you can take the certification, you have to have a certain amount of experience. Most certifications you have to have at least 1 full year. Some require 2 or even 3 before you can apply for a certification. You take an exam, you study for it, you take an exam, and you get an additional certification. A lot of employers will reward you with additional salary or maybe a different level title that kind of bumps you up in salary, or they'll offer things in other ways that kind of differentiate you, maybe a charge nurse role or something like that once you get a certification. If you are working for a hospital that is going for magnet status, this will be something that they require at some point for their nurses, whatever specialty you're in. At some point, it'll probably be written into your contract. Not only do you have to have a bachelor's degree, or at least 90% of their workforce has a bachelor's degree, but they want nurses to be certified specialty a certain time. So, or the majority of nurses to be certified. So that's something that you might want to consider as well. If you, whether or not you decide to pursue an advanced degree, you can also get a certification in your specialty. So now we come to the different, so you have the master's level, doctoral level. So master's level nursing has ways that you can go to. They can go clinical route, or you can route. So the non-clinical is where and folks like who decide they want to be a nurse manager or a nurse administrator, and they'll say, I just want a regular master's in either nursing administration or a master's in hospital administration. It doesn't necessarily have to be in nursing, right? It can be a master's in public health. I know a lot of nurses that decide they want a career in public health, so they'll go and get a master's in public health. And so it depends on what your focus is, what kind of master's degree you're going to go for. The typical ones that you'll find that are nursing based, so Masters of Science in Nursing, or MSN, the abbreviation, is the ones that are in executive leadership or nursing administration, or nursing education. Mine is in nursing education, because I knew eventually I would want to teach, right? So you'll find a lot of nurses who decide they want to go into to become a nurse educator on the inpatient setting will do a Master's of Science in Nursing Education. So there's a difference between those nurse educators that are inpatient and then the ones that teach in the collegiate setting. There are nurse educators who facilitate your orientation process when you're a new grad, and then also do the continuing education of the nursing staff as time goes on and new things come out, new practices come out. They're responsible for educating the inpatient staff. Then you have the educators that work, like I said, in the college setting, right? So again, even with that one degree, you can go so many different routes. So that's your non-clinical master's in nursing. Again, it doesn't have to be in nursing, but a lot of people do choose to stay within. So the focus is more so on has a nursing base. Advanced practice or clinical masters, you have a few different options there too. And by no means is this list exhaustive, right? I just put the main ones, the more popular or common choices that people may make, and later on I'll show you a few different other options. You have these are classified as advanced practice nurses, or APRN, and those are like your nurse practitioner master's tracks, or your nurse midwife master's option, or there is an option to be a certified registered nurse anesthetist, which is always a mouthful. So I'm so proud of myself for getting that right just now. So basically, it's a nurse anesthesiologist, right? It's not a physician role, but it has more of a nursing base. But they are allowed to do many, many, many of this, if not the same procedures as you would find an anesthesiologist. That's another option. Typically, to become a CRNA, you have to have a lot of experience as an critical care nurse in an ICU setting or of some sort, or perhaps even in the emergency room area. They really want you to have a sound background before you can apply to those programs, because they're quite competitive, and they want you to have that knowledge base before you apply. So sorry for the moving around. I'm trying to balance my laptop on my knee since I'm no longer at my desk. We're making this work, guys. All right. So so that's those are the three major options. Again, there's other things in between that you could do. And those are your master's options. So you're not clinical, and then you have your advanced practice. Nurse practitioners, that's become a really, really big field where nurses can practice autonomously or working with a physician. You're able to prescribe meds. You're able to do your own private practice or see patients privately, and bill insurances for patients, or nurse midwives as well have the same functionalities. So there, I just want to make a distinction between a midwife and a nurse midwife. There is an option still in our country and in many countries, to become a midwife without being a nurse. All right, so those are not one and the same. The other programs don't require you to be a nurse. You can be from any field. But to become a certified nurse midwife, you must have a background as a registered nurse, a licensed registered nurse. All right. So the doctoral programs now are also very, very varied in options. I decided I wanted to go the traditional route of getting a doctorate in philosophy, a PhD, but there are other ways to go as well. So what's the difference between, let's say, a doctor of philosophy and a doctor of nursing practice? Well, the doctor of philosophy degree is the traditional research doctorate. So what that means is you find an area that is lacking in terms of research and knowledge, and you attempt to fill that gap by doing your own original research. And there are many ways to do that. But basically, it's a research-based doctorate. So you're creating knowledge based on, or adding to the existing knowledge based on your original research, and the gap in knowledge that you found. The professional or practice doctorate is the equivalent of your Doctor of Nursing practice degree, degree, or another one option is the Doctor of Education degree. Again, by no means are you locked into getting either of these things. You can get any doctorate you want. It can be a doctorate of health administration. I know many nurses that have gone that route. There's also a Doctor of Nursing Science degree. There's a doctorate of business administration. I know some nurses have gone that way if they're more focused on business and administration. So these are common or popular options. This is not an exhaustive list. Right now, the goal is to have nurse practitioners eventually all pursue a doctorate of nursing practice within a certain time frame to complete their education. That's the goal of many of the governing nursing bodies, to really solidify them as expert practitioners in their fields. Is after you've done the NP, then you go on and do your doctorate in nursing practice, because it is a professional doctorate. And so the difference there, outside of being a doctorate, the difference between the practice and the research is that the practice doctorate now takes the knowledge that me as the PhD has generated and then applies it into practice. So they find an area in practice where now these theories or themes that have been generated by by the researchers and the other scholars, and then take a practice area and apply the research and talk about the ways in which they can improve practice. So that's the difference between the two. So I've put here a doctorate of education. That's another very popular choice. I have a lot of colleagues who've gone that way. A lot of my fellow faculty have doctorate of education. Now, can you teach? You say, well, these are practice doctorates. Can you teach with either one of them? Yes. All right. Many programs, if you decide you want to become full-time faculty, will say a doctorate or a terminal degree. A terminal degree is a doctorate, or the highest level of degree that you can get. So it doesn't matter if it's a doctorate of, like I said, health administration, or a doctor of nursing practice, or a PhD. You can teach with either one in higher learning settings, higher education settings. Okay, so we talked about education pathways, and I've kind of infused a few of the different career pathways in there, but we can go through just the different settings and the different ways that you can work as a nurse, right? This is one of the things I absolutely love about nursing. You will find a nurse everywhere in many different settings, in many different fields. You'll just randomly have a conversation. I know flight attendants that are nurses. And so it's just it's one of those careers that's very flexible, so many options, so many interests, and we definitely encourage nurses to pursue many different fields. So you have your traditional roles, like the inpatient setting that I mentioned, the different specialties, right? OB, emergency room, ICU, the operating room is another great option, right? So those are what we call inpatient or acute setting specialties within nursing, traditional, right? Then you have outpatient settings. So not every patient is seen in a hospital, right? Obviously. So, you have your clinics, you have doctors' offices, and other healthcare community-based organizations. You have ambulatory surgery areas that you can work in. So that's an option for maybe the nurse who doesn't necessarily want to do the traditional 12-hour, 3 days a week shifts. Usually the ambulatory option will offer you a Monday to Friday, maybe some weekend days, but not the rotating weekends as the traditional inpatient setting. And usually like within business hours, like a 8 to 4 or a 9 to 5. Then you have community and home health, which is really flexible. You have a lot of autonomy there. You go, you see your patients, you do your documentation, you leave, and you can work from home to do your documentation. You can, some places require you to be in the office at certain points, but there's a lot of freedom there, as long as you get your work done, obviously. But then again, there are some drawbacks to that. You're out there and you're on your own, so you really have to know your stuff and really keep in contact with your employer and your leadership to make sure that you feel supported, because it can be isolating when you're in home healthcare. You don't have, your colleagues just run down the hallway and say, how do you do this again? Or what do you think about that? So, but you can always certainly call somebody. I worked for a really awesome program called Nurse Family Partnership, based in community. And so we would go and see first-time moms, teach them about their pregnancy, what to expect, and we stayed with them in that relationship until the baby turned 2. This was for first-time moms. So that was an awesome community health type of experience. Hospice is another option. So there's inpatient hospice and there's outpatient hospice. Some patients decide to do their end of life care in their homes. And so they'll have a hospice nurse come in, which is like a combination of home health. But then there are also some hospitals that have opened inpatient hospice units. When my mom was transitioning, she was started off in the ICU. And then, once we realized that we would have to withdraw care, they moved her into a hospice unit. So you're able to still be in the hospital setting, but on a hospice unit. I forgot to mention psych as a specialty as well. So psychiatric nursing, God bless them, not my thing, but very much needed service with working with mental health patients. So that's another option in the inpatient. And sometimes there are organizations or facilities that are just tailored to psychiatric patients. So they don't have all the other patient units, it's just psych. Then there's management and administration. So you can be a nurse manager, you can be an administrator of some kind, you can be the head of the hospital. There are some nurses who are vice presidents or CEOs of the hospital. Or you can be a chief nursing officer, which means your purview is specifically based on nursing and nursing practice within the hospital. But then you also have nurses who are the COO, and they go more into operations. Or like I said, the tip top person, the head of the hospital. A lot of nurses pursue that way. And so the gamut is really large in terms of management and administrative roles within the hospital. Some are more based with the hands-on clinical staff, and some are not. Then you, like I mentioned before, you can be a nurse educator. And that's either within the inpatient setting or some kind of clinical setting, or within the educational system. So then we talk about some non-traditional roles, right? So informatics. I don't know if maybe, Nina, if I can ask folks in the chat if they even know what that is. Nursing informatics, or what is informatics? So I'll give a couple of seconds. Maybe some people want to volunteer to see if they can maybe guess what that is even about.
Well, I can just tell you, I don't know.
Yeah. It's a relatively new field. When I say relatively, I mean within the last 20 years. So
some people are saying data collection, ? Informational science, study of management systems and analysis of medical records. Those are some of the
all of the above. Typically or traditionally, what you'll see a nurse in nursing informatics is they have a lot to do with the electronic medical record and how those things work as it pertains to nursing. And like I said, it's a relatively new field, dealing with computer and innovation, in terms of, or I should say, not computer, but technology and innovation as it relates to patient documentation and the electronic medical record. So like many nurse informatics specialists that I worked with, and every time we had a computer or technology-based issue, they would come and they would either do the training or troubleshoot. So they were like nursing IT, if you can think of it that way. They were IT especially for nursing, or not just for nursing, but patient care, right? Because they're able to traverse both the technology world and that whole information technology world, but they also have the knowledge about patient care. So they fuse the two together in some regards. So that's a specialty that you can do in nursing informatics. Then you have folks who work in the quality or performance improvement arena, right? And those are the people that make sure that what we're doing with our patients is safe, that it's best practice, that we're continuously looking to improve our performance. So we have different quality measures that we look at that are either at the local state health department level. Then you have CMS requirements. Then you have Joint Commission. These are regulatory bodies that set these standards. And based on the quality measures and standards that they've set, you have specific people who their role is to come in and look at the clinical practice setting to make sure everybody's basically doing what they're supposed to do, and that our patients are kept safe because we're adhering to these different standards. So that's a really exciting role, and a lot of nurses really thrive in doing quality performance improvement, or quality or performance improvement. Care management, right? So care management is an arm of basically making sure that the patients have what they need once they leave our care, right? So these are folks that are concerned with quality of life, how the disease process or illness will affect quality of life, and what tools and support services these patients will need once they leave the hospital setting. So if a patient is going to need home care, or they're going to need certain equipment, they're going to need crutches, they're going to need a wheelchair, they're going to need a nurse to come in, or whatever equipment they're going to need in the home, or if they're going to need support services, social services. These are folks that help coordinate those things so that there's a smooth transition. We talk about, you'll hear in healthcare all the time, continuity of care or transitions of care. We want to make sure that it's seamless between the hospital setting, where you have everything at your disposal, so once you leave and go to either a subacute facility or back home, if you still continue to need care, but you don't necessarily need to be admitted to the hospital anymore. So those are what care managers do at a very broad, high level. So many nurses go into that and find a lot of fulfillment in there. Forensic nurses work with, patients that to do like with the medical examiner, and they do a lot of care with that world. I don't know too much about it. I have actually never met a forensic nurse, but I know that that is a career option. Legal nurse consultants. So that is a special training that you can do to actually become a consultant that reviews the medical record to make sure, one, that it's complete or accurate, or in case of any litigation, they may call a legal nurse consultant to review that document to see if there are any mishaps or inefficiencies or any ethical issues or what have you that need to be investigated. So That's all about the world of nursing documentation, or patient documentation, the patient medical record. Also, wound care nurses. So that's another specialty and certification, and additional certification that you will have in terms of wound care, managing different wounds, pressure injuries, um, beyond the scope of what the nurse at the bedside would be able to do. Of course, nurses know how to do dressings and different dressing changes, but in terms of really doing a thorough skin assessment, being able to stage what level the wound is, that's where you would consult a wound care nurse and the different treatments that the patient would need based on what kind of wound they have. So they have a lot of in-depth training about how to manage wounds. So those are some of the non-traditional roles that you can have and traditional roles that you can have in nursing. Again, so much more. So right now, I'll give you an example. I am a nurse entrepreneur. As I mentioned, I have 2 different businesses that I oversee. Um, so in the nonprofit space, I operate as the board chair. But in the LLC that I have, it's a consulting company. So I do a lot of things like this, where I do presentations and public speaking. But I also have a specific aim to help decrease disparities in maternal, especially in Black women. So, I do a lot of education and training to families and also to practitioners, to make sure that that we're doing the right things. And I also consult with a few different organizations to help them make sure that they're educating and teaching patients how to advocate for themselves as well. So, so that's just one thing that I consult on, right? So you can take your expertise in nursing and use it in other non-traditional ways outside of being at the bedside, which is what I so much love. So on the job, right? So straight out of nursing school, like I mentioned before, obviously with every job you have an orientation process, right? It will vary depending on what unit that you decide that you want to go into and where you're hired to. The orientation process can vary from 6 weeks, 8 weeks, sometimes. But it really, even after your rotation, it takes some time to really get acclimated, right? So a lot of the orientation is how to do certain things in terms of those aspects things, but it's way beyond that. So it's about critical thinking, how to incorporate everything you now just learned from nursing school through your limited orientation to how it actually manifests in your day-to-day to make it flow, managing your time. So those are the things that take time to really learn and master. So even you become exposed to certain conditions and
Okay, I'm gonna allow a couple of seconds just to see if, oh, okay, looks like she will join us again in a
so I hang on, share my screen again. I have to come out of the show. Okay, so we just finished kind of wrapping up about orientation and really novice at first, and it takes a while to really build up that confidence level and that expertise and knowledge to say that you feel comfortable. Because I was saying that a lot of times on orientation, you may not even get to see the full extent of the different conditions that can come your way, right? So even 2 years in, a patient will come in and you're like, I've never seen this case, a case like this. So you can't even say that you'll be an expert after the first year or two. It definitely takes time. I would say within the first 1 to 3 years is really where you grow and learn and start to build your confidence and expertise in nursing. And it won't fully mature for even quite some time after that. So to help you acclimate, I mentioned a nurse residency program. It's a good idea if you're looking for an employer after nursing school to look for a program with a nurse residency. And the reason why I say that is because it kind of helps fill in those blanks that orientation won't necessarily give you, in terms of delegation, right? So that's a new skill, right? As a nurse, you're going to be working with techs and nurses' aides, and perhaps some facilities still have LPNs, right? So, and if you're working in a nursing home setting, oh, I forgot to put that on there. How did I leave that in there? Long-term care, nursing home is what's classified as long-term care facility or subacute facilities. I totally forgot to put those two things on there, but those are other options as well in terms of career paths. And so if you're working in one of those facilities, you might be the only RN working with a bunch of either LPNs or nursing assistants. And so you're going to have to learn how to delegate things. If you're working on the inpatient setting, you may be deemed as the charge nurse for that day. And you're going to have to learn how to make a patient assignment, right? You have this many amount of patients. Some of them have various levels of what we call acuity, which is the level of care that they need. Some are very low acuity and some need you in the room every second. So you're going to have to know who to pair with what patient. So it's a fair assignment. You don't learn that necessarily in nursing school, right? And your preceptor may not have the time to teach you how to make an assignment, right? Because they're busy trying to make sure that you know all the skills that you need to know to, check the box to say, yes, she knows how to do that, and get you ready to be on your own. Right. So those are just a couple of things that a nurse residency program will help you to do. It also teaches you about teamwork and leadership, right? Because even at the bedside, you're considered a leader to your patient, right? Everything you do affects their life, and so they're looking at you as the expert, and so there's a level of leadership that you need to own as a registered nurse. So it teaches you a lot, and it really bridges the gap between all those little things that you don't necessarily go over in nursing school or your general orientation, unit-based orientation. Day to day, I'd have to say nursing is a very physically intensive job. Um, you're on your feet a lot. It's most hospitals have now moved to the 12-hour shift, and it sounds really great. All right. I only have to work 3 days a week. Awesome. It is very physically taxing. And a lot of times new graduates tend to be hired on the night shift. I was just mentoring this young lady who wanted to go into nursing. And I told her, beware of the night shift. It takes a toll on your body. It's, your body's not used to staying up all night. And so as a new nurse, I worked night shift for some years. And I tell you, my days off, everything just kind of melted into one because I was exhausted. just, I would just sleep and sleep and sleep on my days off. And so you have to learn that work-life balance and really infuse things that you love in between to keep you going, because it can be very stressful. Not to mention the things that you see on a day-to-day basis. People are really sick. People sometimes die. In my area, it was especially traumatic if you had a mom who passed or a baby. So talking about our own trauma and internalizing that on a day-to-day basis, you really need to learn how to take care of yourself mentally too, and give yourself that balance for self-care. On a day-to-day, I would say the biggest thing is learning how to manage your time really well, because you'll have a million different tasks to do, but you don't just have it for one patient, you have it for several. So you have to kind of learn what's a priority, what's a nice to do, what's a must do, right? And in that, try to balance not making your patient feel like they're missing any of it. You want to make them feel like you even did the nice to do stuff, right? Because they deserve to have excellent care. And so that is the part that you're kind of have to figure out as you go. That's why I said it takes like the first 1 to 3 years to really get a hang of that, and your style, of nursing, right? So it's nice to have mentors, but you're going to have to eventually independently develop your own practice style. The way that your patients would describe you, how would they describe you? So that's what I mean by your particular style, your bedside manner, and things like that. But it's physically stressful, but it's very rewarding. When you can see the progress that your patient is making from day to day, when you see a patient go home, or you have a patient that writes a thank you note, it makes the physical stress really worth it. So I would just say to nurses coming into the field, make sure you take care of your bodies, wear the right shoes, get some support hose, things like that. Like, they sound really ridiculous, but they'll help you in the long run. I have back issues now because I, sometimes didn't do the right body mechanics. So take care of your bodies. It's a rewarding field, and it can get stressful. And especially now with COVID and everything going on, you really have to just kind of remember why you went into it to keep you going. But again, the rewards are endless in nursing, and I wouldn't choose another career now. If you tried to get me to start over, I don't think I could do it.
Great, thank
All
you so
right.
much. We are going to head into the Q&A portion at this time.
Yep.
So we do have one question that Michelle just dropped into the chat, and she asks, how do you cope with losing patients?
Yeah, that is a great question. A lot of what you need to do, this is my question and answer slide. A lot of what goes into that, you have to really kind of have an internal fortitude, and a way, an outlet outside of work that you can rely on. So whether that's a really good support system, family and friends, not that you're going to divulge specific patient information, but you have to have a way to get it out, right? So you have your colleagues at work that you can talk to, but when you get home, you also need to have an outlet. You also kind of need to figure out what, in terms of not just venting verbally, but what other kind of activities can you do to kind of keep your mind active in other ways as well. So whether you like to shop or you like to vacation, take your time off. Take your vations, use your time off. Whether it's spiritual, if you like to exercise, yoga, whatever it is, outside of venting and talking about the situation, that's healthy. But you also need other things to kind of make your life interesting, to form of distraction, really. But also therapy. Therapy is essential. If you need a therapist. And a lot of employers, taking it back now to the employer, will offer employee assistance. So take advantage of those things, because I think we have a lot of work to do on the administration side to be a little bit more proactive in offering these things. What we'll say is, here's a pamphlet, or you can call this number, and it's up to the nurse to take advantage of it. But we should definitely be a little bit more proactive, and um, uh, just making sure that you do take advantage of those services when they're offered, and definitely get a therapist on your own if you can, if your insurance allows for it and your finances do.
Thank you. Going off of
Yeah.
that, what do you think do you like most about working in women's health?
Oh, something always drew me to it. I was one of those kids that would watch for hours. Like, you remember that show on TLC, like the birthing story? I've just always been attracted to that world, the whole process of how a baby develops, and the whole birthing process. Watching, I think the joy of it, bringing a new life into the world, and then having the responsibility of taking care of it and showing a mom how to handle a newborn. I think it's just the whole experience, to me, is just something that brings me joy. I can't quite pinpoint exactly what it is about it that I love, but I've always been drawn to that. And I think it's one of the happier areas in nursing. So that might be why I'm more drawn to it.
Thank you so much. Our next question, it kind of pertains to switching specialties. So this person asks, how hard is it to switch between specialties or between clinical nurse versus nurse educator versus home health care?
So I'll start with switching between specialties, right? So I would say you want to make sure that you get a good handle on one specialty before you move on to the other. It used to be like common practice where you'd have to do like a year of just basic medical surgical nursing before you go on to doing the specialties. But a lot of places now have relaxed that and will hire you and just do a more in-depth orientation. But I would say, try if you try something and you're like, okay, I could continue doing this, but I want to try something new. I would say go for it. But just make sure that try not to hop around too soon. We love nurses that have different specialties. The other thing about that is if they know that you have this background, they might try to float you all over the place, but float you away from your home unit. But that's a good thing. I always tell nurses to expand your horizons, look into other specialties. You might start off in one area and think that's it, and then you get to something else and you actually like it. So, but I would just say spend some time really honing your craft in that one area first, at least give it a year to 2 years before you jump to another one, to really get your knowledge base. As far as switching roles from, let's say, a staff nurse to, what was it, a nurse educator, was that the question? Yeah. So then you definitely want to have a good solid background in a specialty area or two before you decide you want to be an educator. So at least a good 3 years, I would say. Let's say you want to be a nurse educator for, I don't know, medical surgical nursing or in an ICU setting. They're going to look to see that you've actually worked in that area of expertise for some time and have a good knowledge base and maybe a certification. And a lot of times they're going to want you to have the advanced degree. So getting that master's will definitely set you up for becoming a nurse educator. But make sure that you have a good clinical background in whatever area that you want. Did I answer everything? I feel like that question had a few parts.
Yes, you did. Thank you.
Okay, great.
The next question is from someone who is applying to get an accelerated master's in nursing. They want to know, what are some jobs you would recommend while going to school for nursing?
Inpatient is always going to be probably the gold standard. If you can get a role that's part-time or per diem. The other flexible options, again, are community health or like an ambulatory care setting that have, out, but the thing is, you have to look at long term. So if you're going to school for a master's degree because you want to become a nurse educator versus you're going to school and you want to be a nurse practitioner, that hands-on inpatient experience is key before you switch over. So if you've got a good bank of time that you've worked in those areas before you move on to the advanced practice role, that's fine, but they're gonna always go back to your background. So you can't graduate from a master's program and say you only have 1 year of bedside experience. Not gonna have a lot of hiring capability, right? So you wanna at least per diem, stay within whatever field that you eventually want to work in, specialty you want to work in, and hone your craft, because it's going to be trouble trying to hire you straight out of school if you don't have background to go with it.
Thank you so much. The next question we have is, what would you say are the best things we can do to learn more about the diverse populations when we'll take care of them in terms of cultural competency in the healthcare field? And do you have any books or research to recommend or that we should read?
Shoot, I wish because we just did this whole thing, but so I happen to chair the Diversity and Equity and Inclusion Committee. It's absolutely crucial for us to incorporate those aspects into everything that we do in nursing. I would say that prior to getting, maybe this person sounds like they're just getting into the field or still in a nursing program. volunteering with a community-based organization. Whenever you hear of those opportunities to go and work in the community, because a lot of times what happens is, on the back end, will hire nurses and we're just filling positions. But really what you want is whatever facility, wherever that facility is, it should mimic the community around it, right? The people that work there should look like the community that it's serving. So you want to start to get into volunteering for different organizations. It doesn't have to be volunteering in the hospital. It can be just working with the community, because those are the patients that you're going to end up seeing in the hospital anyway, right? As far as resources, look at the, hang on 1 second, let me come out of here, pull this up real quick. Hopefully it doesn't slow me down. See if I just did this presentation. Hang on, I'm gonna pull it up that way. The agenda, I think it's on there. Okay, so there's two websites that I'll lead you to. The Macy Foundation, macyfoundation.org. It has a lot of resources in terms of diversity and equity and inclusion in health careers. And then, and it's a free membership. And then the Association for Prevention, Teaching and Research, aptrweb.org. They have a lot of anti-racism resources and things like that that you can look into. There's so much more stuff. I can maybe just email it to you, and maybe you could send it out as a separate email to your members.
Yes,
that's okay.
Great, thank you.
Then thank you. The next question is, how did you balance working and going to school? And kind of based off of that as well, if you ever experienced burnout.
Yes. No, I'll answer the first part. Work balance. And so you have to, one, determine what type of schedule you can handle and what type of learner you are. For me, I knew after, because I went the traditional way. So straight out of high school to college, and that's the traditional path. So I didn't have a full-time job when I was doing my bachelor's, right? I would work per diem here and there because I had the LPN license and I could do that at my own pace. But some people have to work a full-time job or a part-time job to sustain themselves. And so you have to kind of know your limits. You have to know what you can handle and what your home life requirements are, and try to find that sweet spot. I knew once I got into the working world that I wouldn't be able to do another brick and mortar setting, like a full-time program in person. So that's why I chose to do an online program. But many people can't handle the freedom of an online program, because I do the air quotes because there really isn't any freedom. You're tied and tethered to that computer all the time, right? Some friends would make fun of me because I had my laptop literally everywhere. And you have to kind of discipline yourself too, because it can kind of feel like that pseudo freedom, but you have to make sure you get time in to do your assignments. There's a self that happens. And a responsibility on you, the student, to make sure you're getting the most out of the program. So that decision between online and in person, you have to kind of balance a lot of those things and just find the right fit for you, depending on your learning style and how you do best academically. So that's what worked for me, but it might not work for everybody else.
Thank you. One last question before we wrap up is, how has the pandemic affected your work schedule? Hello? Oh, did we drop?
I think yeah.
Okay. All right, no worries. We can just go ahead and jump right into our wrap up. Please give me one moment, as I was not ready for this. Alrighty. All right, so we can go ahead and jump into this. I will share my screen. Thank you guys again for your patience. No worries, no worries. We are running a little bit late, so I decided to just go ahead with our wrap up. But if you wanted to continue wherever you left off, we can wrap up this question.
Yeah, as far as the burnout, which I think that's the last piece of the question, I certainly have experienced that, but I would never ever leave nursing. You just have to pivot. Like I said, there's so much that you can do. You don't have to feel trapped in one role. It could be just the hospital that you're working at. Maybe down the street is another hospital where the problems that existed at your current place doesn't exist, and they have a much better work culture. So when you're looking for a job, try not so much. A lot of new grads fall into the pit of looking for the salary, which is important. Absolutely, you have to pay your bills, but look at the work culture. What are people saying about the facility in terms of how they treat each other and how they treat their employees? What's the patient care like? What are their outcomes? These are other things to consider. And if you fall into a place where you don't feel supported, or you feel that burnout and you've voiced that and nothing is changing, go somewhere else. Nurses are always in demand. Always. Don't ever feel trapped. Or just shift to something else, maybe it's the specialty. Maybe you're tired of that. Maybe it's time to move on to a different specialty.
Thank you so much. And I appreciate you joining us today. Despite the bad connections, we really appreciate you moving around to try to get that better connection. So thank you so much for joining us.
You're so welcome. My pleasure.
For all of my students today, I encourage you, like I said during one of our breaks, I encourage you to reflect on all of these sessions. This will be really helpful for you going forward when you're applying to your professional programs. And so these are just some reflection questions. These are not mandatory. You don't have to submit them or anything. We just ask that you do this on your own, just to stay in touch with what your thoughts are in the current moment.
Is it okay if I just share my screen one last time? I just have my contact information if anybody maybe wants to take a quick screenshot of it.
Yes, of course. Thank you.
Okay. Yeah, I would love to keep in touch with anybody who has further questions. So these are all the places that you can reach me. All right.
Since
I'll
we'll
leave it up for a
a few more minutes, if you guys want to take a picture, take a screenshot on a Mac, I can tell you it's Shift Command 3. That's all I know.
I use that quite frequently.
I just learned it. Now I'm screenshotting everything.
All right, so I can take it down now because I know you have other things you want to share. But thank you so much.
Thank you so much for joining us. All right, I'm going to continue my presentation. So just, do your reflections. Not mandatory, but we definitely recommend it. Next announcement, this is a different QR code than the one I presented at the beginning of this virtual shadowing session. This is actually to join our fundraising team rather than to donate. So this does not require you to donate any money. This just says, okay, you're a part of our team, and when you send out your invitations, you can actually track how much money you're raising personally. And so we do award participants that have high donation rates. So if you are getting lots of donations for pre-health shadowing, you might be the top person and you might be eligible to win something. But you also get volunteering hours for this. And so I encourage you guys to please share the GoFundMe link. It's the only way right now that we are staying afloat and paying for all of our website upgrades, mailing upgrades, Zoom, and all of the above. So I appreciate you guys. Another announcement is to join our student team. We are a student-based, student-led team. We started mid-September and are currently with over 8,000 students in our program. You get to meet with like-minded students and gain some professional skills. It's 100% remote, and it's really great because you can kind of make some new friends, people that you don't necessarily have within your hometown reach. And so it's a really great opportunity. If you don't have a lot of time, we understand you guys are all pre-health students and it's really hard to fit things in. We also have volunteering opportunities, and this is great because it's also remote, and you get to work as many or as little hours as you would like. And if the only time you have is at 2 o'clock in the morning, you're more than welcome to help us out at 2 o'clock in the morning, and we really appreciate you guys. So you can sign up on our website or using this QR code. And Follow us on Instagram to never miss a virtual shadowing session. We do post updates with our speakers, as well as other free resources for you guys. And so we encourage you guys to stay updated with us. I have a challenge for you today, and that is to comment the professional's last name letter by letter under the Instagram post. So you guys can go to our most recent Instagram post and comment the person who beats the algorithm and gets all of the letters in order, stacking, and it makes sense, will potentially get the opportunity to be the student of the session. Don't forget to tag us at pre-health shadowing and use the hashtag pre-health shadowing to get the opportunity to get reposted. Like I said earlier, we're not a secret. We want everybody to know about us so that they can all utilize the resources that we are providing. So we are asking you guys to please share this. Please post it on your stories. Please send out emails. You guys will get volunteering hours, and you are a great help, and we appreciate you all so much. Our next shadowing session is on December 21st. You guys can register on our website if you use pre-health shadowing/sessions. These Zoom links are made available 30 minutes prior to the session start time, and you can take the post-shadowing assessment. So I'm going to go over how you can do that for today's session. You are going to go to our website and go to the speaker profile. To the right of Dr. Dunkley's picture, you are going to see free take this course. When you click that, it will take you to the post-shadowing assessment, which you will have 30 minutes and 2 tries to get over a 70%. The moment that you pass, whether it's the first or the second time, I encourage you to download your certificate. If you pass the first time and decide to take it a second time and you do not pass, your eligibility for the certificate does go away. So please ensure that if you are retaking to pass with a higher score, that you save your certificate, because we will not be able to provide you the certificate if you fail the second time. If you guys do not see your certificate popping up, be sure to return to the speakers page and click finish course. If you do not hit finish course, you won't receive your certificate, so just make sure that you guys do that. When you do so, your certificate will be downloadable immediately, and you can always find it in your profile under the certificates tab. If you guys have any questions about this or experience any issues, feel free to reach out to us at info@prehealthshadowing.com, and I hope to see you at our next session. Thank you everybody for joining us today. That concludes our virtual session for today. I invite you to disconnect from the call.